Hi, how are you today? Well, today I'm going to talk about what do you do after you have your dialysis treatment. So this is kind of sort of how your arm will look when you come out of treatment. They will put the gauze and they'll tape up your arm. And it's really tight. So usually I leave this on my arm between 4 to 6 hours after I have my treatment. Each person can be different, but I just do it just to make sure all the bleeding just about is stopped. So now I'm going to show you what I do to take care of my fistula. So I'm going to wash my hands first. Make sure your hands are clean before you start doing anything with your arm. So now that my hands are clean, I'm going to take the tape off. I'll peel the tape off. And each tech will put the tape on different. So some techs put little tabs to make it easier to pull off, and some techs don't. So now that the tape, now that the tape is off, now I'm going to get certain things together. I have a paper towel. I have some gauze just in case there's still some extra bleeding. I have my tape, and I use cocoa butter. So the first thing I'm going to do is get some soap. And as you can see, right now there's really no bleeding. So now I'm going to clean my arm. So I just take some soap and I'll rub the area, turn my water on, and then I just kind of rub it on my arm. And you'll do this for wherever your fistula is. So now that I've cleaned my arm, I take my paper towel and now I'm going to wipe my arm down good. So now that my arm has been cleaned off, I kind of see a few minutes if any of the bleeding is going to come out. Looks like today the bleeding may have completely stopped. So what I'm going to do is, since there is no extra bleeding, and then I'll check it just to be sure. It's a little tiny bit. I don't know if you can see that. So it's not quite bleeding a lot, but there's just a little bit. So to be on the safe side, we're going to put a little bandage on here just in case there's just a little bit more bleeding. So I take a gauze, and I try to conserve my gauzes because it's not a lot of bleeding. So I split this type in half. And then all I do is I get me a piece of tape. And you can make the length as long as you want. Then I look at my arm and then I fold it up based on, I can either do it like this, or because it's not really bleeding that much, I can fold it like this. Then I just take the tape, I put it in the middle, and then I just take where the little bleeding is, I place it down, and then I just push it like that. And then if the other one is bleeding, I do the same thing. Then afterwards, I take a little cocoa butter. And I use cocoa butter just because it seems to help your fistula stay dry and not cracked up. It keeps it moist. I'm sorry, I said dry. It keeps it moist. And it helps with, to me, helps with the healing since you're getting stuck 3 times a week. And then after that, this is how it looks. And I'll take this off, maybe in an hour just to make sure it start bleeding. And that's how I clean my fistula after dialysis. Thank you.